May is Lupus Awareness Month. Lupus is a disease that occurs when your body's immune system attacks your own tissues and organs, aka autoimmune disease. Inflammation caused by lupus can affect many different body systems, including your joints, skin, kidneys, blood cells, brain, heart, and lungs. Lupus is a disease that affects women way more commonly than it does men, and it's also 3 times more common in African American women than in Caucasian women. Some symptoms of lupus are fatigue, fever, joint pain, stiffness, and swelling, the butterfly-shaped rash on the face that covers the cheeks, bridge of the nose, or rashes elsewhere on the body, like your extremities, skin lesions that appear or worsen with sun exposure, fingers and toes that turn white or blue when exposed to cold or during stressful periods, shortness of breath, chest pain, dry eyes, headaches, confusion, and memory loss. You should go to see a doctor if you have an unexplained rash, ongoing fever, persistent aching, or fatigue. Some of the tests used for lupus is the ANA test, anti-nuclear antibody, complete blood count, CBC, complement tests, and there are other ancillary tests as well. Types of lupus are SLE, systemic lupus erythematosus, drug-induced lupus, cutaneous lupus, and neonatal lupus. Lupus results from a combination of your genetics and or your environment. It can be caused or spiked by sunlight, infections, or medications. Risk factors of lupus are your sex, because lupus is more common in women, as stated before, your age. Although lupus affects people of all ages, it's most often diagnosed between the ages of 15 and 45. And your race. Lupus is more common in African Americans, Hispanics, and Asian Americans. Complications of lupus. The inflammation caused may affect many areas of your body, including your kidneys, brain, blood, lungs, and or your heart. Other complications include infection, because people with lupus are more vulnerable to infection because the disease and its treatments can weaken the immune system. Another complication is cancer, and other complications can include bone tissue death and pregnancy complications. Treatments for lupus can include NSAIDs or non-steroidal anti-inflammatory drugs, anti-malarial drugs, corticosteroids, immunosuppressants, and biologics. Lupus is very close to my heart because my dad suffered from lupus before he passed away, and it affected almost every organ in his body, and it took a toll on it. So that is something that I'm very aware of, and I wanted to bring awareness to lupus because it is Lupus Awareness Month. So if you see any of these symptoms in yourself or a loved one or anyone that you know, be aware of them and ask them to go and get checked out, or you go and get checked out, just to make sure that you don't have this disease and that you can rule it out. So you all be safe, take care of yourselves, take care of your bodies, and be aware.